Hello and welcome. Time for some helpful hints related to the respiratory system. In this chapter, we are dealing with some commonly seen conditions such as pneumonia, COPD, asthma, atelectasis, which remember from medical terminology is just a collapsed lung, and also the condition of respiratory failure. Two things to keep in mind within this chapter. Number one, COPD, chronic obstructive pulmonary disease, is always caused by another condition. And respiratory failure is always due to an underlying condition. So it's important to be sure that your principal diagnosis and your secondary diagnosis are properly assigned in this chapter. This is especially true with respiratory failure, where the principal diagnosis depends upon the patient's unique situation and whatever it was that prompted the admission to the hospital in the first place. For example, perhaps a patient with emphysema develops acute respiratory failure. If the admission to the hospital is for the treatment of the acute respiratory failure, then that would be coded first. So you would post the J96.00 for your acute respiratory failure, and then your secondary code would be for the emphysema, the J49.3. So remember how in past discussions we referenced chapter-specific coding guidelines in the front of your CM code book? Well, acute respiratory failure is another one of those conditions that is referenced specifically within the guidelines. So again, take a look at those guidelines each week before you begin a new chapter of coding. Let's just take a quick look. So again, here we are in the Chapter 10 Respiratory Chapter-Specific Coding Guidelines. You can see that acute respiratory failure is addressed. It talks about ARF as a principal diagnosis, as a secondary diagnosis. It even addresses some sequencing concerns when it's coded with another acute condition. So again, a good place of reference. Don't be afraid to check these out each week. Another acute respiratory failure example where guidelines come into play is shown with this diagnosis. The patient has an accidental overdose on crack cocaine, is admitted with acute respiratory failure. Here we're going to be referencing guidelines in Chapter 19 for injury and poisonings as we have an overdose or a poisoning due to crack cocaine. So in the specific guidelines, Chapter 19, Section E5B, in regard to poisoning, when coding a poisoning or reaction to the improper use of a medication, for example, overdose, wrong substance given, first assign the appropriate code from categories T36 through T50. Again, first assign. It's giving us some sequencing guidance here. And then down here, as we keep reading through the poisoning guidelines, use additional codes for all manifestations of the poisoning. In this case, that would be the acute respiratory failure. So as far as sequencing goes, we'll start, the first code would be starting in the table of drugs, which we've covered in a few videos now. Table of drugs, find the listing for cocaine, and then we find the column related to poisoning accidental because we have an accidental overdose, an accidental poisoning, which leads us to code T40.5X1A. And then as our secondary code, we'll pull in that acute respiratory failure, J96.0. Let's walk through one more example from the handbook, this time from exercise 18.3. Here we have total tension pneumothorax, spontaneous recurrent left. So that's our diagnosis. And then as the procedure, we have the video-assisted thoracoscopic surgical pleurodesis left pleura. So let's first take a look at the diagnosis. So here we have the pneumothorax. Basically, this just means that we have air or gas that's collected in the pleural cavity, so that space between the lungs and the chest wall. So first we'll find the main term of pneumothorax, find our subterm for tension, and spontaneous is also pulled in here. This leads us to code J93.0. You can also see that there was another way to get here. You could also go to spontaneous, subterm tension. Again, we get this same code, J93.0. And if we check the tabular list, you will see that this code does check out okay. So we're looking good so far for the diagnosis. Now let's take a look at the procedure code, which is this pleurodesis procedure. So let's think back to our medical terminology. We have pleuro, meaning the pleura, and desis, meaning to bind together. So what this procedure does is it creates or produces adhesions in that pleural space. It binds that space together so that the air or gas can no longer collect in there. So this definition of a procedure is nice to have in mind. Again, don't be afraid to do some research. So when we're finding our code, it's nice to have this visual in our head. So we start with the main term of pleurodesis in the alphabetic index of our PCS book. Again, we're doing the procedure or the service. It gives us two options, biochemical or surgical means, and in our documentation we have surgical pleurodesis, so this is the route we're going to take. C, destruction, respiratory system, so we'll head to table 0B5. Then we will head down to the back of the book, find our table. We have our left pleura, which you will find in the table is the character P. Then we will have number 4 for the approach, which is percutaneous endoscopic. Now, how do we know this is percutaneous endoscopic? It doesn't state that in the record, right? Again, putting to work that medical terminology. Whenever you see something documented as thoracoscopic, so right, pertaining to visualization with the scope of the chest, or you may see laparoscopic, pertaining to visualization with the scope of the abdomen. All of those are going to relate back to percutaneous endoscopic, right? Pertaining to within with a scope. Okay, so we know we're going to put, again, that terminology to work for us. Thoracoscopic is telling us it's a percutaneous endoscopic approach. And then also in the table, when you get there, you'll be pulling in 6 and 7 characters as a Z. So our final code, 0B5P for the left pleura, 4 for percutaneous endoscopic, and then ZZ. So thanks for joining me, everyone. Happy coding. Have a great week.